Hand washing is another procedure that we in the United States take for granted. Part of the biggest reason why we take this for granted is because it's not uncommon to easily find flowing clean water and a type of soap available at many places where we use the bathroom or begin to eat our meals. However, in developing countries, lack of hand washing is still the third largest contributor to the spread of infectious disease. Because in some areas, including many countries in Africa, less than 50% of the areas have coverage that ensure safe hand washing procedures. It's estimated that inadequate hand washing results in 300,000 deaths each year, with the majority of deaths being children younger than 5. Hand washing with soap can reduce the prevalence of pneumonia and diarrhea, two leading causes of childhood mortality worldwide. Poor hand washing compliance is also one of the major contributors to the healthcare associated or hospital associated infections, otherwise known as HAIs or nosocomial infections. It's essential that hospital workers, nurses, and doctors continually wash their hands as they go from patient to patient. Yet this doesn't always happen. But hand washing, even in your own private home or when you go out to eat at restaurants, can be essential in preventing diarrheal infections and respiratory infections. Food safety is another major focus of health departments in the United States and around the world. Leaders of the sanitation movement, initiated in the early 1900s, recognized that typhoid fever, tuberculosis, scarlet fever, botulism, and other diseases were transmitted by food, including milk and water, and advocated safer food handling procedures, including pasteurization, refrigeration of food, hand hygiene, especially for chefs and cooks, and safer food processing procedures, as well as pesticide application. Well over 30 different bacteria, viruses, protozoa, prions, and worms are transmitted by foodborne diseases. In 2011, the CDC estimated that 1 in 6 Americans suffered from a foodborne illness in the United States every year. This accounted for over 100,000 hospitalizations and 3,000 deaths. Helping to alleviate this major concern, President Obama in 2011 signed the FDA Food Safety Modernization Act, or FSMA, that increased the surveillance, monitoring, manufacturing, and labeling of various foods around the United States. The Food Safety Inspection Service of the U.S. Department of Agriculture is charged with the safety, labeling, and packaging of the nation's commercial supply of meat, poultry, and eggs. However, every year, as I'm sure you read about in the news, there are new cases of foodborne illnesses spread and transmitted to people. The most significant foodborne pathogen, E. coli 0157H7, was first recognized in 1892. In 1996, PulseNet, which is a network designed to track foodborne illnesses at a national level, was established. PulseNet actually tracks the DNA fingerprint or DNA tracers of bacteria from the patient and allows the determination of the spread of disease to see if patients are infected with the same strain of foodborne illnesses, and also possibly where these foodborne illnesses were originally acquired. This helps the United States departments, health departments, and USDA identify potentially contaminated food sources to stop further spread of disease and recall potentially food in such an outbreak. In figure 315A in your book, there's a description of how the CDC and health officials identify, detect, and find the cause of an outbreak as a result of the spread of disease. Infectious disease surveillance is essential in slowing the spread of disease in a population. Improving sanitation, hand hygiene, and providing access to clean water and ensuring food safety are all basic measures that the World Health Organization and the CDC in the United States advocates for. Infectious diseases are the second leading cause of death in humans worldwide and continue to be a major public health problem. Of these major health issues, HIV and AIDS, tuberculosis, and malaria are considered the big three because of their large impact on global human health. Thankfully, here in the United States, those last two are almost all but eliminated as a result of health department, CDC, and governmental agencies monitoring, surveillance, and mitigation strategies. However, the surveillance systems that allow us to continually monitor these various diseases are crucial and involve three main steps. The three surveillance strategies are disease-specific surveillance, syndrome or symptom-based surveillance, and event surveillance. Many of these rely on laboratory data, demographic data, such as information about various cases, deaths, and absenteeism from work and schools, data from hospitals reported from physicians, data from pharmacies, and other types of data that may come from the internet or health hotlines. Disease-specific surveillance is focused specifically on one specific disease, as you can tell by the name. These various government agencies track one specific disease, and it's pretty common that state health departments will send anonymous reports about diagnosis of such diseases to these disease-specific surveillance agencies. These disease-specific surveillance agencies can be done with a wide range of pathogens and are very useful for following disease trends because they closely monitor individual specific diseases. The syndrome or symptom-based surveillance provides real-time data collection on non-specific indicators of the health status of a population. These are not specific to a specific disease, but are a general description of the overall health status as a result of school or work absenteeism rates. Finally, there are event surveillance strategies that gather data from diverse internet sources or health hotlines. While they don't use more scientifically rigorous reporting, such as that from physicians, hospitals, or pharmacies, they can also be an essential part in the surveillance of various epidemics, as they are more likely to be closer to the general population, especially in populations that don't have easily accessed medical care. Well, that's it for Chapter 3. I hope you learned a little bit more about how the United States is so helpful in mitigating the spread of disease in the background without you even realizing it. In the next section, we're going to be learning a little bit more about the basics of microbes and basic biology information.